Hello, everybody. I'm Kavi Bhalla. I'm an assistant professor in the Department of International Health at the Johns Hopkins School of Public Health at the International Injury Research Unit. I want to start by thanking first the Overseas Development Institute for hosting this event. From 2007 to 2012, I co-led the injury expert group of the Global Burden of Disease study. And the sole purpose of my research during that period was to construct estimates of road traffic injuries in the most information-poor settings to improve the GBD results. None of that research would have been possible unless the World Bank Global Road Safety Facility had funded us. Their generous funding not only allowed my salary to be supported, but it also allowed me to maintain a small team of researchers who went about finding data from the most information-poor parts of the world, bringing them in and developing methods on how to parse these into global burden of disease estimates. And in an indirect sort of way, I want to thank the FIA Foundation, because although they haven't funded us, their funding to the World Bank Global Road Safety Facility made it possible for our work to happen. So thank you, Saul. Perhaps what is most innovative about this report is that it brings together estimates of injuries and air pollutions from road transport in the same framework. In 2012, in the opening sentences of the Safe and Sustainable report Kevin Watkins wrote, "The road traffic injuries epidemic is the product of transport policies that put vehicles, highways, and speed before people and road safety. The same vehicles first approach poses a threat to efforts to tackle global environmental problems, including air pollution and climate change." This report is our response to that statement. It is our attempt at trying to quantify how many people die from road traffic injuries, as well as from air pollution from motor vehicles. Now, it's important to understand what we haven't been able to do in this report. So there are clearly many important reasons why governments and development agencies build roads. If you look on this slide, you can see the green bubbles show you the reasons why governments and development agencies support road building. Roads and highways help bring jobs, get people to jobs, give them access to jobs in schools. Roads and highways help people get access to food markets, hence their nutrition depends on it. And roads and highways give them access to hospitals and healthcare, and so they have a very direct impact on health. However, there's a range of negative impacts on health from roads and vehicles. And we have been estimating how many people die and get injured in road traffic crashes. Later in the session today, Aaron is going to talk about the burden of air pollution. We have not been able to calculate the amount of burden of physical inactivity that is due to an over-reliance on motorized road transport. The global burden of disease has estimated that over 3 million people die from physical inactivity. We do not know what proportion of that is due to motorized road transport. It is likely a large proportion. Plus, I should say that there are things on this chart that we may never be able to quantify. So for example, you see a bubble called community severance. And what that is referring to is that when roads are built through communities, they can tear the community apart. So as an example, surveys have shown that when children grow up near roads, as the roads attract more traffic, they have fewer friends. And I don't think we'll ever be able to put a number on what it means for our children not to have friends. However, we can put a number of how many people are dying from road traffic injuries and air pollution, and hopefully someday physical inactivity. Now, Aaron will talk about air pollution. Let me say a few words about what is novel in the global burden of disease results for road traffic injuries. Perhaps the most novel thing that we did over the last 8 years was that we brought in many, many, many more injury data sources to the global burden of disease exercise. We went after data sources that had never been used before for constructing estimates of the incidence of road injuries. On this chart, you see a long list of data sources, which includes death registration systems, verbal autopsy surveys, mortuary registers, burial registers, censuses, household surveys, hospital databases, prospective studies of disability outcome, to name a few of the data sources that we brought to this study. Now, it is not usual to try and tackle so many data sources in the same sort of study. In fact, our main competitors, for example, is the WHO Global Status Report, where they generate estimates of global road traffic deaths, and they only use death registration data. But as we all know, in most parts of the world, death certificates are not assigned for people. So except with the notable exception of South Africa, most of sub-Saharan Africa has no death registration systems. So by bringing in country data sources, this is the first time we actually can talk intelligently about what's happening at the country level. Because we had so many new data sources to handle, the next major innovation was developing methods to be able to handle those new data sources. And because we had new data sources, new methods, we've been able to make estimates that have never been made before. So as an example, the GBD 2010 generated the first estimates of the number of non-fatal injuries that happen in the world, and estimated that 78.3 million people get injured in crashes, with injuries severe enough to warrant medical attention if such attention was available to them, if they had access to medical care. That's one sort of innovation. Another major finding is that we can now compare at the country level how countries are doing in terms of being able to measure road safety. Here you see how China and India are doing in terms of truthfully reporting how many people die and get injured from road traffic crashes. So for example, in China, government statistics, which are based on their national traffic police, report that every year 65,000 people die from road traffic crashes. The global burden of disease estimates for China, which are based on the disease surveillance points data as well as their death registration data, which is getting to be nearly complete soon, the estimates are 283,000. It's 4 times the estimates that are the official government statistics. India has a similar story. The government statistics based on National Traffic Police are 130,000 deaths. GBD estimates, which are built up from their India's sample registration system, as well as the medically certified causes of death and their survey of causes of death for rural areas. Based on those estimates, we predict more than twice as many road traffic crashes than what the government is reporting. And these 2 countries account for almost half of the global road death toll. It should give you a sense of how bad the problem is globally. And this chart is showing you where the worst underreporting is happening. The way it is colored, it is designed to pick out the worst areas in the world. And you can see that India and China have an underreporting problem, but it's worst in sub-Saharan Africa. So I would like to conclude by making 2 points. First is that we need better estimates of all health impacts of transport. I've talked about how we need to improve road injury estimates. Aaron's going to talk about how much we need to do on air pollution, but there's also this big glaring hole in our research on not measuring the effect of physical activity. So that needs to be done. Secondly, I want to point out how we need better road injury estimates if the safe systems approach can be implemented in developing countries. Now, at the World Bank, in the Global Road Safety Facility, there is a new vision of what road safety means. This new vision is called the Safe Systems Approach. It's been developed over the last 10 years at the World Bank. Essentially, this vision talks about empowering institutions in the countries that can actually roll out interventions. These institutions are supposed to make targets, then come up with a plan of interventions to implement getting to those targets, then monitor what's happening, whether those targets are being met, and then come back and come up with a whole new set of interventions. Now, this approach has been enormously successful in Western Europe, including the UK. It has allowed the UK and almost all of Western Europe for 4 decades to continuously improve road safety. If you look at time trends for all of Western Europe, road safety has improved steadily since 1970. The World Bank is now talking about rolling out this vision to all developing countries. And our mission over here is to make sure that the metrics component of it is strong enough to actually be coming up with interventions. So there are 2 aspects to this metrics component. One is what to do in places like sub-Saharan Africa, where data sources are just really, really bad. And in that setting, we need approaches like the global burden of disease approach, where you take all existing data sources and construct estimates so that those estimates can be used for road safety policy. In other parts of the world, the information-rich developing countries, like much of Latin America, where they have good death registration systems, the challenge is to link up that data with the road safety programs to make sure that the data is being used to do evidence-based road safety policy by their government institutions that are empowered to do road safety. I think Kevin Watkins is absolutely right when he links up our over-reliance, our vehicles first approach with the epidemic of road traffic injuries we have. The way out of that problem is to take the approach that Europe took in the 70s and has continued to take since. And we have to find the way to make sure that the metrics are available so that low and middle income countries can walk the same path. Thank you.
Thank you. Kavi, thank you for that really thought-provoking presentation. Because I mean, I guess the key point here is if you haven't got the data, it's very hard to frame the guidance for policy. But I guess one question I have for you, though, is that you engage a lot with policymakers on both sides, on the transport side and on the health side. Do you actually find, say, in your dialogue with transport ministries, road infrastructure planners, that there is a growing concern to think about the road traffic injury side of the equation?
It's been my impression that usually it's the transport side that realizes that there is a huge problem, and the advocates we've had for road safety have always been within the transport sector. It seems like health has come late to the game, although when the Global Burden of Disease first put out the studies in the 1990s, that was the first time where health could actually see how big this issue was. I think the people who have been in transport have not known what to do about it, and the Safe System Visions points us to what to do about it.
Thank you. Thank you so much.